Welcome to Thought Frontier.
Welcome back, everyone. We're diving into system dynamics today. It's all about how this approach is being used to tackle some tough problems in public health.
It's a fascinating area for sure.
Definitely fascinating. It's about seeing the connections that are sometimes hidden, how things like individual choices, healthcare systems, and even the environment all kind of work together to shape the big picture of, health and well-being.
But before we jump into all that,
Yeah.
let's make sure we're all on the same page here. Like, what exactly is system dynamics?
Right. It's a whole way of thinking, isn't it? It's not just a buzzword,
You're absolutely right. It really is.
Yeah.
At its core, it's about understanding how systems change over time. It's about how the actions we take have consequences. And those consequences ripple through the system and then feedback to affect things that are going to happen in the future.
It's like that bathtub analogy where the water level is like a public health problem, like diabetes or something like that.
Right.
The faucet is like the inflow, so the new cases. And then the drain is like people who are recovering or sadly passing away.
Yeah, that's a great way to visualize it.
Yeah. So by adjusting those, taps and drains, we can see how different interventions might actually impact that problem as a whole. It's pretty cool.
Absolutely.
And it reminds me of something you were saying earlier about the roots of system dynamics in engineering. It's about Jay Forrester, who was the founder of system dynamics.
Right, yeah.
And his background in control theory, like how a thermostat works, helped shape this whole field.
His work was truly groundbreaking.
Right.
He really realized that those principles that we use to, design and control physical systems could also be applied to social systems as well.
So it's not just about a single thermostat.
Right.
It's about understanding how all the thermostats in a building work together to, impact the temperature of the whole building.
Exactly.
And in public health, it's like how all those individual behaviors, social norms, healthcare policies, all that stuff, all comes together to influence something like obesity rates.
Precisely. And that kind of leads us into one of the key concepts of system dynamics.
Okay.
Which are these feedback loops. The idea that actions have consequences that kind of circle back and influence things later on.
So it's not just a straight line, it's a loop.
That's it. It's a loop.
Yeah.
Exactly. And those feedback loops can either amplify an effect, making a reinforcing loop, or they can counteract it, making a balancing loop.
Oh, right.
Do you remember that chicken and egg example from the transportation paper?
Yeah, with the chickens. More chickens lay more eggs, which means more chickens. So that's a reinforcing loop.
Exactly, a reinforcing loop.
Yeah. But then more chickens also means more, road crossing.
Right, yeah.
Which unfortunately means more chickens getting hit by cars, reducing the population.
Sadly, yeah.
So that's the balancing loop.
That's the balancing loop, exactly.
So you've got these two loops constantly sort of pushing and pulling on the chicken population, right?
Exactly. They create this kind of dynamic equilibrium.
Okay, yeah.
And it's the balance between those loops that really determines the ultimate outcome. Now, imagine applying that same principle to something like the spread of a disease.
Oh, okay.
You can begin to see how things like vaccination campaigns can create feedback loops that either help spread the disease or slow it down.
That's really interesting. Okay, so we've got these feedback loops that are kind of influencing the whole system. But what about the actual pieces of the system itself, the things that are changing?
Right.
That's where this idea of stocks and flows comes in, right?
Exactly. So think of stocks as the accumulations within a system. Like in the bathtub, it's the amount of water in the tub. In a public health context, it could be the number of people with a certain disease. Now, flows are different. The rates of change that affect those stocks. So in the bathtub, it's the water flowing in from the faucet or out the drain.
Okay.
In public health, it would be the number of new cases or the number of people who are, recovering.
So stocks are like a snapshot.
Yeah.
In time. And flows are what's constantly changing that snapshot.
That's exactly right.
Okay.
And by understanding that interplay between stocks and flows, we can start to see how different interventions might impact the system over time. Like, a vaccination campaign wouldn't instantly change the number of people who are already infected.
Right.
That's the stock. But it would affect the flow of new cases, leading to, hopefully, a decrease in that stock of infected people over time.
So So we've got these feedback loops that are kind of going around and around, and these stocks and flows that are like always changing. But there's got to be another layer to this, right?
Yeah, okay.
It's not enough to just see the pieces moving. We need to understand why they're moving
Right.
the way they are.
That's where it gets really interesting, where system dynamics can provide deeper insights. We need to understand like the underlying causal structure of the system. We can't just look at things that happen at the same time.
Yeah.
We've got to dig into those cause and effect relationships.
It's like that saying, correlation doesn't mean causation.
Right.
Just because ice cream sales and crime rates go up in the summer doesn't mean that one causes the other.
Exactly. They could both be influenced by something else, like hot weather,
Right.
without any direct connection between them. System dynamics pushes us to ask those deeper questions.
So how do we actually use this in public health? Like, can it really make a difference?
It already is. Look at chronic disease prevention. The paper, System Dynamics Modeling for Public Health, really highlights how system dynamics can explain why we put so much effort into managing chronic diseases, but not so much on preventing them.
Yeah, it's like we're always playing catch up, isn't it? Like we're always reacting to these problems.
Exactly, we are. And system dynamics can help us get out of that reactive cycle.
Okay, yeah.
The paper presents this model that looks at, it calls it upstream and downstream prevention.
Okay.
So upstream is about preventing the disease from ever happening in the first place, like getting at those root causes.
Right.
And downstream is about managing the complications for people who already have it.
So it's kind of like upstream is fixing that leaky faucet.
Yeah.
And downstream is trying to bail out the water.
Perfect analogy.
That's already on the floor.
That's it. That's exactly it. And what's really fascinating is this phenomenon of resource squeezing that they talk about in this model.
Okay.
So when we focus so heavily on downstream prevention, managing those complications, we can, without even realizing it, be taking resources away from those upstream efforts.
So it's like we're so busy bailing out the boat that we don't have time to fix the hole.
Yes, exactly. You got it.
So we might actually be making it harder to prevent the problem in the first place.
Exactly.
Wow.
And this creates a really, a vicious cycle. Fewer resources for upstream prevention means more people getting the disease, which means more complications, which then further drains those upstream efforts. It's a classic example of a reinforcing feedback loop, but with bad consequences.
Oh, wow. That's heavy. And the paper mentions this isn't just for chronic diseases, right?
No, not at all.
This is happening in other areas of public health.
It is. You see it everywhere. Think about the opioid crisis, right? We can pour tons of resources into treating overdoses and providing, addiction services, which of course are crucial.
Yeah.
But if we don't get at the underlying causes of addiction in the first place, the things that drive it, like social isolation, lack of economic opportunity, the overprescription of painkillers. If we don't deal with those things, we're just treating the symptoms, not the actual disease.
It's like mopping the floor while the bathtub is still overflowing. We need to turn that faucet off.
We do. And that's where system dynamics can be so valuable. It can guide us, help us to identify those places where we can step in and have the most impact, like those high impact interventions.
Right.
Like maybe investing in early childhood education to help kids grow up healthier, or, even things like changing zoning laws to make it easier to get healthy food.
And the What is System Dynamics Modeling paper talked about using this to predict those unintended consequences, right? It's like having a crystal ball for making policy decisions.
It kind of is, in a way.
Yeah.
By building these models, these dynamic models, we can actually run simulations. And we can see how different policy choices might actually play out over time. We can ask those what-if questions.
That's cool.
And hopefully spot those potential unintended consequences before they actually become real-world problems.
That's amazing. That makes me think about what that paper said about the need to develop these models more quickly.
Right.
Especially, when you're dealing with new health threats.
That's right.
Like new infectious diseases.
Imagine if we could model how a new virus might spread, in real time.
Yeah.
We could see how different interventions might change the course of that outbreak. Things like travel restrictions, social distancing, vaccination campaigns.
Yeah.
We could even simulate the potential impacts of new treatments or vaccines while they're still being developed. It could completely revolutionize the way we respond to pandemics.
That's incredible. But let's be realistic here. Building those models takes a lot of time, resources, and people who really know what they're doing.
You're right. It does.
And then there's the whole challenge of getting policymakers to use them.
That's true, too. But, system dynamics isn't some kind of magic solution. It takes collaboration. It takes sharing information. It takes a willingness to embrace the fact that these things are complicated. But I really believe those potential benefits are so huge that it's worth pushing for. I think if we can get better at using system dynamics, we can make major strides in preventing diseases and improving people's health outcomes and in creating a more resilient and equitable health system.
It's funny, thinking about all these complex systems, it's made me realize that system dynamics isn't just for researchers and policymakers.
Oh, absolutely not.
It's it's a way of thinking that everyone can use, in their everyday lives.
Yeah.
It's how many times have we tried to fix something by only focusing on one tiny part of it?
Right.
And then it just creates a whole bunch of new problems somewhere else. It's like squeezing one part of a balloon.
Yeah.
Another part's just going to pop out.
That's a great analogy. And that's what system dynamics does. It reminds us that we can't, isolate problems. We have to think about the whole picture, all those connections, all those unintended consequences.
Okay, so how can we actually start thinking more like system dynamicists, in our own lives?
I think it starts with just being curious. When you see a problem, whether it's something big, like obesity rates going up, or something in your own neighborhood, not having a lot of places to buy healthy food.
Right.
Don't just accept it.
Sure.
Ask yourself, why is this happening? What are the things that are contributing to this?
It's like being a detective, right?
Yeah.
Trying to figure out all those cause and effect relationships.
Exactly. And remember that paper that talked about the need for, checking that your ideas about what's causing things are actually right.
Oh, right.
We can't just assume we know all the answers.
Yeah.
We have to really test our assumptions.
Yeah.
We have to look for evidence. And sometimes we'll be surprised by what we find.
Like that example we talked about earlier, where making the roads safer could actually lead to more accidents.
Right. Yeah.
Because people might start driving faster. It's not always obvious what the right solutions are.
That's where the real power of system dynamics comes in. It can help us design those interventions that are going to be more effective. They're going to last longer. And this is important. They're going to be more fair for everyone.
More fair? What do you mean by that?
Well, it makes us think about who's benefiting from the way things are now and who's not. It helps us see how different policies or interventions might actually have different effects on different groups of people.
So, if we're trying to make it easier for people to see a doctor, we can't just assume that building a new hospital is going to fix everything.
Exactly.
We need to think about, how are people going to get to the hospital?
Right.
Can they afford to go?
Yeah.
Are there any cultural things that might prevent them from going? All those things.
Exactly. System dynamics helps us move beyond those really simple solutions and think about how to create something that's going to work for everybody.
This has been so interesting. It feels like we've just started to learn about what system dynamics can do.
I know. It's a huge field. But hopefully we've piqued your interest, given you a new way to look at the world.
Definitely.
Because ultimately, we're all part of these complex systems, right? And the more we understand about them, the better we'll be at navigating them.
Yeah.
And at creating change for the better.
That's a great point. So to all of you listening out there, as you go about your day, I want you to put on your system dynamics glasses.
I love that.
Start noticing those feedback loops, those unintended consequences, those places where you might be able to do something to make a difference, because even the smallest things we do can have a ripple effect,
Absolutely.
And remember, system dynamics isn't always about finding the answers. It's about asking the right questions.
That's such a great point.